Okay, let's dive into the notes you shared today. We're focusing in on one specific condition, geographic tongue.
That's right. We've got this material here, and the plan is really to unpack it, make it clear, high yield, so you can really get a handle on this condition.
Exactly, cutting through the noise. Geographic tongue, I mean, the name itself paints quite a picture, doesn't it?
It really does.
So let's just jump right in. Based on these notes, what actually is geographic tongue?
Well, the notes sometimes use the more formal name, benign migratory glossitis.
Right. Benign migratory glossitis. Bit of a mouthful.
Definitely. Geographic tongue is much more descriptive, but essentially what we're told here is it's a benign condition, so, not harmful, that affects the surface of the tongue.
Okay, benign. That's good to know up front. And how does it look? What would you see?
The key thing, and this is where the name comes from, is you see these irregular sort of map-like patches on the tongue surface.
Map-like patches. Okay, yeah, I can picture that. What do those patches actually consist of? What's the detail in the notes?
So the description is quite specific. These patches are areas where the filiform papillae, those tiny little bumps covering the tongue.
Yeah, the normal texture.
Exactly. They're basically flattened or missing in these patches. The notes call this papillary atrophy.
Papillary atrophy. Got it.
And these smooth areas, often reddish, are typically surrounded by a slightly raised border that might be whitish or maybe reddish too. It's that pattern, the outlined smooth bits, that looks like a map. And it changes.
Okay. Smooth red areas outlined. Sounds pretty distinctive. Is it common, or is this quite rare?
Actually, the notes state it's considered a common condition. Affects somewhere between 1% and 3% of the population.
1 to 3%. Wow, that's quite a few people. More than I would have guessed.
It is,
Yeah.
and the notes also point out it seems to be slightly more common in females.
Okay, so common, visually unique, slightly more in women. Now, the big question, maybe the frustrating one, do the notes tell us why people get it? What's the cause, the etiology?
Yeah, this is where it gets interesting. The notes are pretty clear that the cause is, well, uncertain.
Uncertain, really, for something affecting potentially 3% of people.
It seems a bit strange, doesn't it? But yeah, the thinking outlined here is that it probably comes from a mix of things, genetic factors and environmental ones.
For combination.
Right, so while there isn't one single known cause, the material does list several potential contributing factors, things that seem associated.
Okay, like what? What kind of things are mentioned?
Things like stress, possibly hormonal changes, which might link to why it's seen more in females. Certain foods are mentioned, irritants, even some vitamin deficiencies are floated as possibilities. But again, the notes really emphasize, the definite cause isn't pinned down.
So it's like a combination of suspects, but no smoking gun. Okay. Given that uncertainty, are there things that make someone more likely to develop geographic tongue? What about risk factors?
Yeah, the notes list a few. Family history comes up, which points towards that genetic link we mentioned.
Makes sense.
Also, having a history of other oral conditions, or even certain skin conditions, is noted as increasing the risk.
And you said female sex is a risk factor too?
Yes, that's listed again explicitly. And another interesting point is an association with some systemic conditions, like psoriasis and allergies.
Psoriasis, allergies. That's interesting. Suggests maybe some kind of broader inflammatory or immune system connection, perhaps?
Potentially, yes. Even if the exact cause isn't known, those links are suggestive.
So speaking of the how does it actually happen biologically? What's the pathophysiology described in the notes? Does it explain how those patches form?
Well, mirroring the cause, the notes state the exact pathophysiology is also not fully understood.
Okay, another mystery then. But what do we know about the process?
What seems clear is that it involves some kind of disruption to the normal cycle of epithelial cell turnover on the tongue surface. The skin cells are always replacing themselves.
Right, regeneration.
But in geographic tongue, that process gets disrupted in patches. It goes a bit, haywire.
And that leads to the look.
Exactly. That disruption leads directly to the papillary atrophy, those little bumps flattening out or shedding off, causing those smooth red patches. The notes do say the specific mechanisms behind this disruption are still being investigated.
So we know the what disrupted cell turnover, flattened papillae, but not the precise why of the disruption. Fascinating. Okay, let's just quickly revisit the epidemiology. How common is it globally and maybe locally, according to the notes?
Sure. As we said, globally, the range is generally cited as 1% to 3%.
Which is pretty common.
Right. The notes do mention specifically that prevalence in the UK isn't that well documented, which is maybe a bit surprising.
Hmm.
But overall, it's definitely seen as a common condition, and it affects all sorts of age groups, children right through to adults.
Good to know. Common, all ages, UK data, a bit patchy, ironically. So, back to the clinical side. What does someone actually see and feel? Can we detail the clinical features?
Absolutely. The main sign, obviously, is the appearance, those irregular, well-defined patches, usually on the top surface, the dorsum, and the sides of the tongue.
And the color.
Typically erythematous, so red, and often, like we said, with that characteristic whitish or grayish border. The notes really highlight how this resembles a map outline.
And that migratory part of the other name, benign migratory glossitis.
Yes, that's key. These patches aren't fixed, they change. Size, shape, location. They can shift around over days, weeks, appear here, fade, pop up somewhere else. That's the migratory geographic aspect.
So the map keeps changing. It sounds visually quite dramatic. Does it feel dramatic? Do patients have symptoms?
Well, many people are actually asymptomatic. They don't feel a thing, might not even know they have it unless someone points it out.
Okay.
But the notes do say some individuals experience mild discomfort or sensitivity.
Sensitivity, like to hot or cold, or
Sure.
specific things.
Usually to specific foods. The notes mention a burning sensation sometimes, particularly after eating spicy or acidic foods. Those seem to be common triggers for discomfort.
Okay. So often nothing, but sometimes a burn with spicy or acidic stuff.
Got it.
Now, because other things can happen to the tongue, what about differential diagnoses? What else might look like this?
That's a really important point clinically.
Yeah.
The notes list several conditions to consider. Things like oral thrush, that's a yeast infection.
All right, candidiasis?
Yes. Also oral lichen planus, which is inflammatory. Another type of candidiasis called erythematous candidiasis.
Yeah.
Leukoplakia, those white patches you need to be careful about.
Definitely.
And also just general glossitis, inflammation of the tongue, maybe from vitamin deficiencies. These can all sometimes resemble geographic tongue.
That's quite a list. Shows why getting the diagnosis right matters, even if geographic tongue itself isn't serious. So how is it diagnosed? What investigations are needed according to these notes?
Okay, here's a key high-yield point from the material.
Yeah.
Diagnosis primarily relies on the characteristic clinical appearance.
Just by looking at it. Usually no tests.
That's what the notes strongly suggest. It explicitly says no specific investigations are typically required. Seeing those shifting, map-like patches with the typical features is usually enough.
Okay, that's helpful. A visual diagnosis mostly. But given those lookalikes you mentioned, when would tests be done?
Good question. The notes clarify that if there's some doubt maybe the appearance isn't quite typical or there are other concerning features, then tests like a biopsy might be done.
Ah.
But, and this is important, the goal of those tests isn't usually to confirm geographic tongue itself. It's more to rule out those other conditions on the differential list.
Right, ruling out the alternatives if needed. Makes sense. So once it is diagnosed as geographic tongue, how is it managed? Is there a treatment?
Another really important takeaway from these notes?
Yeah.
Because it's benign, geographic tongue often doesn't require specific treatment.
No treatment needed, even if it looks quite striking or causes a bit of sensitivity.
That's what the notes indicate, yes. For most people, if management is needed, the focus is really just on relieving any symptoms and maintaining good oral hygiene.
So what if someone does have that burning or sensitivity? What can they do?
The notes suggest avoiding the triggers like those spicy or acidic foods we talked about.
Okay, avoidance first.
Yes. And if the discomfort is, actually bothersome, then gentle mouth rinses or maybe topical medications could be used for relief. But that's really only if symptoms are present and problematic.
Any other management points mentioned?
Just the importance of regular dental checkups, really, just to monitor things. And crucially, patient reassurance.
Ah, reassurance. That seems huge here.
Absolutely. Given how it looks, explaining clearly that it's benign, it's not cancer, it's not contagious.
Yeah.
That reassurance is probably one of the most important parts of management noted here.
I can imagine. Knowing it's harmless must be a massive relief. So what about the long term? What's the prognosis like?
The notes describe it as a chronic condition, meaning it can last a while, but it's fundamentally benign.
Chronic but benign.
Okay. It can be self-limiting, might go away on its own eventually, but often it has this pattern of waxing and waning periods where it gets better, periods where the patches come back or seem worse.
Comes and goes, potentially.
Exactly. But the good news, stressed in the notes, is that most cases don't cause significant problems. They're asymptomatic or mildly symptomatic. And importantly, no complications.
And the most reassuring bit.
The notes are very clear. There is no progression to oral cancer or any other serious conditions associated with geographic tongue itself.
That's definite and very reassuring indeed. So, just to be absolutely sure, are there any complications directly linked to it in these notes?
The material basically says geographic tongue is generally harmless with no serious complications.
No direct physical complications listed.
No. The only potential issues mentioned are the ones we've covered, that mild discomfort or food sensitivity. The notes do acknowledge that, rarely, the appearance might cause some anxiety or affect self-esteem, but it makes a point of saying this isn't a direct physical complication of the condition itself.
Understood. So physically harmless, according to this information. The main issue might just be how it looks and the occasional sensitivity.
Precisely.
Yeah.
Looks dramatic, maybe feels a bit sensitive sometimes, but the underlying reality presented here is, it's benign.
Well, that was a really thorough walkthrough of geographic tongue based entirely on the notes you provided. We've covered the definition, the look, the uncertainty around the cause, the risk factors, the differentials, diagnosis, management focusing on reassurance, and that positive prognosis.
Yeah, we've really tried to pull out the core information from this source material.
So a final thought for you, listening to this deep dive. Perhaps it's that contrast we kept seeing. You have this visually striking, changeable condition on the tongue.
Very visible.
And yet, the notes consistently emphasize its completely benign nature. It's maybe a good reminder that clinical signs aren't always proportional to severity. Sometimes the most dramatic-looking things are fundamentally harmless.
It's definitely an interesting point to mull over. Thank you for joining us as we explore geographic tongue, drawing directly from the information shared with us today.
We hope this discussion has helped clarify things and solidified your understanding of this rather unique condition.
Yeah, maybe think about those key points. The visual versus the benign reality, how common it is despite the unknown cause, and the importance of that clinical diagnosis and reassurance.
Until next time.